with that, I turn it over to the panel, and I guess Professor Bundorf is going to go first.
Okay, thank you, Lauren. I thought today I would talk about the election, and we could talk a little bit about the positions of the different candidates. I have to say that when Bob stood up here and said he wasn't going to go there, I feel like now I am a woman who will go where Bob Kocher fears to tread. I also must say that Doug has told me 3 times that at least that this must be nonpartisan, right? So I'm not afraid. I'm ready to go. I'm just afraid that I can't do it in 5 minutes. So here we go. Okay, so I thought I would talk about the the candidates' positions on the health insurance. I'm going to focus on the health insurance expansions. That's kind of where we have some data and evidence and estimates. A couple caveats. The candidates' proposals are kind of a moving target, so not everything will be perfectly correct for the moment, but I think they're generally directionally correct. Positions are not policy. Anything we see up here has a very long road to actually being enacted into a policy, as I'm sure folks know. And I do just want to acknowledge the sources for some of the estimates that I'll be talking about. RAND Corporation a nonpartisan research organization, put out in September some estimates of the effects of a Trump versus the Trump set of proposals versus Hillary Clinton's set of proposals, and the Center for Health and Economy back in July did some estimates on what they thought the Trump proposals would look like, and will soon be coming out with Hillary Clinton's proposals, but unfortunately that is not quite ready yet, so that's what I'll be focusing on. Okay, so what are the main differences between the candidates? Well, it's pretty stark and up there in the top line. Clinton wants to expand and build on the ACA, and Trump wants to repeal it, right? So those are two very different positions. In terms of the specific things that Clinton wants to do, she would, and now I'm just going to go through and talk about some of the features of the ACA and think about how each candidate would, or what each candidate has had to say. The individual mandate, Hillary Clinton obviously wants to maintain it. We've talked a little bit about the public option. She has been pro-public option for many years, and I think this issue of the public option has become very salient to people as insurers have started to announce that they are leaving some of the exchanges, and there's a concern about the number of competitors and even some exchanges having any insurers left to offer coverage. She would, in terms of insurance market regulation, she would probably maintain the ACA regulations, or that's what her position is. Where she has proposed some new extensions is thinking about subsidies for private health insurance. So in the ACA now, folks who don't have offers in other places and are low and middle income can get subsidies for a private health insurance plan. She has proposed increasing those subsidies for the people who are already eligible, so keeping the same group of folks eligible for the subsidies, but making the subsidies a little bit larger in order to address these issues of affordability. But she also has a new subsidy in there. She has this new cost-sharing credit for people with high out-of-pocket expenses relative to their income. One thing that's interesting about this is it doesn't just apply to the people who are in the exchanges, it applies to everyone. So the elephant in the room there are people with employer-sponsored coverage. So if they had a high out-of-pocket spending, they might be eligible for this type of subsidy. In terms of Medicaid, this won't be what I'm going to talk about now with respect to Medicaid isn't reflected in any of the estimates that these analysts have put together, but more recently she's put some information on her website about some kind of financial incentive to encourage the states who have not participated in the Medicaid expansion to go ahead and do so. And for employer-sponsored health insurance, she wants to repeal the Cadillac tax. Turns out that repeal the Cadillac tax is the only item of similarity between the two candidates. That's where they agree. They should have, yeah. So that's the point of agreement. Okay, so let's talk a little bit about Trump. Trump is all about repealing the ACA, individual mandate, get rid of the health insurance exchanges. With respect to insurance market regulation, the analysts who have looked at these policies have basically talked about what repealing regulation would look like would be a return to the state-based regulation that we saw prior to the ACA. So states had very different policies with respect to guaranteed issue and premium rating practices and whatnot. He has stated that he favors allowing the sale of insurance across state lines. The idea here is to try to encourage competition among plans and offer folks more choices. The folks who are not in favor of that worry about a regulatory race to the bottom. It's basically a way for insurers to get around a state's set of consumer protection regulations. In terms of subsidies, he'd eliminate the ACA subsidies. He does have a new subsidy on the table, and that would be basically to extend the current treatment of employer-sponsored health insurance in the sense that he wants everyone to be able to deduct premiums from their taxable income. In terms of Medicaid, he would replace the Medicaid program with block grants. Because he has said he wants to repeal the ACA, the way the analysts have interpreted that is that he would basically pull back the Medicaid expansions, no longer provide Medicaid for the expansion population, and base that block grant spending on those who were eligible for Medicaid prior to the expansion. In terms of employer-sponsored insurance, he wants to basically not have an employer mandate and, as I said, repeal the Cadillac tax.